Ever feel like you're just swimming in information, trying to get your head around something complex? That's exactly why we do this. Welcome to the deep dive. Our whole mission is simple. Take your sources, articles, notes, whatever you've got, and pull out the really crucial stuff. Think of it as your shortcut to, really getting it. Today, we're diving into something pretty specific, but really important. Amitraz toxicity in horses. And it's a fascinating case, actually, because you've got this chemical that's widely used, pretty standard in some ways, but for horses. Incredibly dangerous and totally different story.
Yeah, that's right. And the sources we're working from today are comprehensive veterinary excerpts. So we're aiming for a really detailed, evidence-based look at this, not just scratching the surface.
Okay, great. So for you listening, our mission today is to unpack why. Why is this seemingly common stuff such a threat to horses? What actually happens if they're exposed?
Yeah.
And maybe most importantly, what can vets actually do about it? Stick with us, because there are some surprising facts and honestly, critical insights here that will leave you properly informed on this specific veterinary issue. Right, let's start at the beginning. What is Amitraz exactly?
Okay, so Amitraz is, chemically speaking, a formamidine-based acaricide.
Acaricide, meaning it kills ticks and mites.
Exactly. Ticks, mites. And it's also an insecticide. So, it's pretty common in vet med for controlling those kinds of external parasites on various livestock. We see it used in cattle, sheep, goats, pigs, even dogs.
But here's the catch, right?
Here's the first really crucial nugget for you. Amitraz is generally not recommended for horses, period. They have an extreme sensitivity to its effects. That's the absolute key distinction right off the bat.
So if it's not meant for them, how does exposure even happen? Is it just accidents?
Accidents are a big part of it, yeah. Oh. Accidental ingestion, maybe they get into feed where it's spilled or lick a container, or improper topical application. Someone might mistakenly use, say, a concentrated cattle dip on a horse, or just a product that isn't formulated for them at all. Even just getting it on their skin, dermal exposure can cause problems.
Okay, that makes sense. Accidental stuff.
But there's another angle, and it's frankly quite concerning.
Oh.
Exposure can also happen through deliberate, illicit administration, usually intravenously.
Deliberate? Why would someone do that?
To try and alter performance in athletic horses. They're trying to leverage its sedative or tranquilizing effects, basically trying to calm a horse illicitly.
That's disturbing.
It is. And there's one more subtle danger. When Amitraz solutions are stored, especially if not correctly, they can actually break down over time, and the breakdown products can sometimes be more toxic than the original Amitraz.
So even stored product could become more dangerous.
Potentially, yes. It adds another layer of risk.
Okay, that deliberate misuse part is really troubling. It just shows, well, it highlights the need for awareness on all fronts, doesn't it?
It absolutely does. Accidental exposure, improper use, and deliberate misuse. They're all potential pathways.
Right, let's get into the mechanism then. Once it's in the horse's system, how does Amitraz actually wreak havoc? What's it doing?
So its primary action is as an alpha-2 adrenergic receptor agonist.
Okay, alpha-2 agonist. Sounds technical. Can you break that down?
Think of these alpha-2 receptors as tiny switches in the horse's nervous system and in various organs, too. Amitraz comes along and basically flips these switches on.
And flipping those switches causes problems.
Widespread problems, yes. And here's something that might make it click. It's the exact same type of switch that common equine sedatives target. Things like xylazine or detomidine that vets use routinely.
Ah, okay. So it's like it's activating the horse's own sedation system, but in an uncontrolled, toxic way.
That's a good way to put it. It's hitting the brakes hard on their central nervous system and other body systems.
So what does that look like? What are the signs in the brain, the CNS?
Well, you see profound CNS depression. That means obvious sedation, lethargy, muscle weakness, and ataxia.
Ataxia, that's the stumbling, right? The incoordination.
Exactly. A wobbly gait, stumbling, you often see it more in the hind limbs. And if the dose is high enough, or the horse sensitive enough, this can progress. We're talking loss of consciousness, stupor, even coma in severe cases.
Wow.
You'll also often see meiosis, constricted pupils. That's a classic alpha-2 effect. Although, interestingly, in really severe late-stage cases, the pupils might actually dilate, become mydriatic.
In body temperature.
Hypothermia is common. Their temperature drops. Tremors or even seizures are less common, but they can happen with really high doses.
Okay, so mostly depression, stumbling, low temp.
Mostly, yes. But here's a crucial nuance, something a bit surprising.
Go on.
While depression is the usual story, very low doses can sometimes cause the opposite. Hyperreactivity. The horse might be jumpy, overreact to sounds or touch, even show aggressive behavior.
Really? So it's not always sedation.
Not always, especially at the lower end of exposure. It's less common, but important to know it can happen.
Okay. Now, I've heard the gut is where things get really, really bad for horses with Amitraz. Is that right?
That is absolutely right. And this is probably your next critical takeaway. Horses are particularly sensitive to the gastrointestinal effects. It can lead to severe, potentially fatal impaction colic. Essentially, their digestive system just grinds to a halt.
The gut just stops. That sounds terrifying for a prey animal like a horse.
It is terrifying. And the key sign, the sort of hallmark clinical finding, is decreased or completely absent gut sounds. We call that ileus or stasis. If a vet listens with a stethoscope and hears silence, that's a huge red flag for Amitraz, potentially.
And that leads to colic.
Yes, ranging from mild signs initially to incredibly severe pain. Often it's due to a large intestinal impaction. The manure basically gets stuck and hardens. A common spot for this is the pelvic flexure, which is a hairpin turn in the large colon.
So like a blockage?
Exactly. You might also see tympanic colic, where gas builds up because nothing's moving through. The horse will likely stop eating completely anorexia and stop defecating. Or if they do pass anything, it might be just small, hard, dry fecal balls, sometimes covered in mucus.
Any other GI issues?
Yes. Gastric reflux is a major concern too. If the stomach and small intestine are also static, contents can back up into the stomach, distend it dangerously, and potentially even reflux back up the esophagus. That's a very serious complication.
Yeah, that sounds awful. What about other systems? Heart, lungs?
Yes, it hits those too. Cardiovascular signs typically include bradycardia, that's a slow heart rate, and hypotension, meaning low blood pressure. Actual heart rhythm problems, arrhythmias, seem to be rare, thankfully.
And breathing.
Bradypnea, a slow respiratory rate. And in severe cases, that can progress to significant respiratory depression or even complete respiratory failure, which obviously can be fatal.
So it slows the breathing right down.
It does, and it's worth noting. If the horse has also been given another alpha-2 agonist, like maybe xylazine for sedation before the Amitraz toxicity was recognized, those effects can add up and make the respiratory depression even worse. It's an important interaction to be aware of. There are other effects too. You often see hyperglycemia, high blood sugar. That happens because Amitraz messes with insulin release, it inhibits it, and it stimulates glucagon release.
Okay.
You might also see sweating. And then there's anuria, or oliguria, basically. Decreased or no urine production. That's because it inhibits antidiuretic hormone, or ADH.
So kidney function is affected too.
Indirectly, yes. And if it was a skin exposure, you might see localized skin reactions where the product was applied. Occasionally, things like facial swelling or even tachypnea, fast breathing, and tachycardia, fast heart rate, have been reported, though they're less typical than the slowing effects. And a key reason horses are hit so hard. It seems Amitraz is metabolized, broken down by the body, more slowly in horses, particularly ponies, compared to animals like sheep. This slower breakdown means the drug hangs around longer, causing more profound effects.
Okay, so putting this all together, recognizing it sounds like a real challenge. Lots of these signs, colic, depression, wobbliness, could be so many things. So for you listening, trying to spot this, what are the real uh-oh signs? When do things start happening?
Yeah, the timing is key. Signs usually pop up pretty quickly within hours of exposure. And this is important, they can last a while. We're talking 24 to 72 hours, sometimes even longer if it's a severe case.
And the big ones to watch for.
The most common and clinically really significant signs are that persistent impaction colic that just doesn't want to resolve, lasting days sometimes, plus profound depression, the ataxia or incoordination we talked about, and just general muscle weakness or incoordination. Those are the heavy hitters.
Right. And as you said, that makes it tricky for vets. Colic could be anything. Depression and ataxia might look like, I don't know, West Nile virus or liver problems causing brain issues, hepatoencephalopathy, meningitis, even a brain tumor.
Exactly. The differential diagnosis list is long, so vets need tools to help narrow it down.
What kind of tools? What can they test for?
Well, routine blood work can offer clues. You might see dehydration markers like increased total protein and packed cell volume, maybe a mild acidosis. But the key indicators on blood work are often that hyperglycemia, the high blood sugar, and hypoinsulinemia, low insulin. Those point towards that alpha-2 effect on glucose regulation we mentioned.
Okay, so blood sugar is a big clue.
It can be, yes. And then particularly if there's suspicion of illicit use in a performance horse, specialized drug testing labs are the way to go. They have methods, sophisticated ones, to detect Amitraz itself or its main metabolite in blood or urine.
So they can definitively test for it if needed.
If needed, and if the samples are taken appropriately, yes. And in sad cases where the horse doesn't survive, a post-mortem exam, a necropsy, can sometimes provide evidence. Pathologic findings might include seeing that fecalith, that rock-hard manure obstruction in the small colon, often just past a really large, severe impaction in the large colon.
Okay, so we've got the danger, the signs, the diagnosis. Let's talk treatment. If a horse is exposed, what can be done? You mentioned earlier there's no specific antidote, right?
That's correct. There's no magic bullet, no single injection that just reverses Amitraz. Treatment is really focused on two main things: decontamination, if possible, and intensive supportive care. Managing the symptoms.
Okay, decontamination first. What does that involve?
Depends on how they were exposed. If it was dermal on the skin, the absolute first step is immediate, thorough washing. Soap and lots of warm water. Just get as much of it off the skin as possible, as quickly as possible.
And if they ate it? Oral ingestion.
If it was very recent, say within maybe 1 to 2 hours, and if the horse is stable enough neurologically that they won't aspirate, then activated charcoal is often given, usually via a nasogastric tube, that tube down the nose into the stomach. Charcoal helps bind the toxin in the gut.
What about pumping the stomach? Gastric lavage.
It might be considered in really severe recent ingestions, but honestly, it carries a pretty high risk of aspiration pneumonia in a horse that's already sedated or wobbly from the Amitraz. So it's not done routinely. Activated charcoal is usually the preferred gut decontamination method.
Right, okay, so decontamination is step one. Now, what about tackling those alpha-2 effects directly? Is there anything that can counteract the Amitraz?
Yes, and this is often the most critical part of the treatment, especially for the severe signs like the colic and sedation. We use specific alpha-2 adrenergic antagonists. These are reversal agents.
Reversal agent. Okay, now we're talking like what?
The main one used in horses is yohimbine. It's a selective alpha-2 antagonist. Given intravenously, slowly, it can produce a pretty rapid reversal of many of the key Amitraz effects.
Like what specifically?
It can reverse the sedation, the bradycardia, slow heart rate, the hypothermia, and crucially, it can help reverse the ileus, that gut stasis. Getting the gut moving again is often paramount in these colic cases.
So yohimbine is key for the colic part.
It's often the most critical medical intervention for the colic, yes. The typical dose is around 0.1 to 0.125 milligrams per kilogram, IV slowly. And because Amitraz can last a while, it might need to be repeated.
Okay. Any other reversal agents?
There's another one, atipamezole. It's also a potent and selective alpha-2 antagonist. It's sometimes considered, sort of, a newer generation because it's even more selective for those alpha-2 receptors, including a specific subtype called alpha-2D, where it has a much higher affinity than yohimbine.
Is it used much in horses?
It's well documented for reversing Amitraz in cats, for example. Its use in horses is perhaps less widely reported or maybe newer compared to yohimbine, but its efficacy is recognized based on its mechanism. The suggested dose is usually around 0.1 milligrams per kilogram IV, so it's another tool in the toolbox.
Got it. So yohimbine, maybe atipamezole.
Yeah.
These target the core problem. But you also mentioned supportive care is vital.
Absolutely vital. You can't just give the reversal agent and walk away. These horses often need intensive care.
Like what? What does that involve?
First off, fluid therapy. Intravenous or IV fluids are crucial. They help with hydration, support blood pressure and circulation, and help flush the toxin out of the system. We might need to add electrolytes to the fluids depending on the horse's blood work.
Makes sense. And what about managing that awful colic?
Aggressive gastrointestinal management is key. Besides the reversal agent, this means lots of oral fluids, again, often via a nasogastric tube if they aren't drinking. Lubricants like mineral oil or DSS can be given down the tube to try and soften the impaction. Regular hand walking, if the horse is stable enough, can sometimes help encourage gut motility.
Any medications to get the gut moving?
Prokinetic agents, drugs like lidocaine given as an IV drip or metoclopramide might be considered. But importantly, these are usually only used after the main alpha-2 effects have been antagonized with yohimbine or atipamezole. Using them too early might not work well against the strong inhibitory effect of Amitraz.
And that gastric reflex you mentioned.
If that's happening, gastric decompression is essential. That means passing the nasogastric tube repeatedly to relieve the pressure buildup in the stomach. It's critical to prevent the stomach from rupturing.
Okay, fluids, aggressive gut care. What else?
cardiovascular and respiratory support. We need to monitor their heart rate and rhythm closely. The bradycardia often responds well to the yohimbine. If their blood pressure is dangerously low, severe hypotension, they might need vasopressor drugs to bring it up. And if their breathing is severely depressed, oxygen supplementation is needed. In the absolute worst-case scenarios, mechanical ventilation, basically putting them on a ventilator like in human ICUs, might be required, though that's intensive and not always feasible.
Right. Anything else for general care?
Yeah, basic nursing care is huge. Blankets if they're hypothermic. Monitoring their blood glucose, although giving insulin is rarely necessary despite the hyperglycemia. And keeping them in a safe, deeply bedded, quiet stall is important to prevent them from injuring themselves if they're work wobbly or severely sedated. Oh, and one really important don't. Atropine should not be used.
Why not atropine?
Horses are very sensitive to atropine's effects on the gut. It's an anticholinergic, and it can severely slow down gut motility even more, which is the absolute last thing you want in an Amitraz colic case. It can make the impaction much worse.
Good to know. Any other drug interactions to worry about?
Yes. Potential adverse interactions with other sedatives like xylazine, as we mentioned, also with tranquilizers like benzodiazepines, for example, diazepam. And some sources mention potential interactions with certain dewormers, the macrocyclic lactones like ivermectin or moxidectin. So the treating vet needs to be cautious about any other medications being given concurrently.
Okay, that's a lot involved in treatment after all that. What's the outlook? What's the prognosis for a horse that's gone through this?
Generally speaking, the prognosis is considered guarded to good, but that really depends on how severe the exposure was, how quickly treatment was started, and crucially, whether those alpha-2 antagonists like yohimbine were given early on.
So quick action makes a big difference.
A huge difference. Most horses that survive the initial really severe phase, especially getting through that impaction colic without complications like rupture, tend to recover completely, usually within about 24 to 72 hours after the specific treatment, like the reversal agents, begins.
But if it's not treated or treated too late,
then the prognosis is much poorer. Untreated or severe cases absolutely can be fatal. Death can occur from respiratory failure, cardiovascular collapse, or complications from that irreversible intestinal impaction, like the gut rupturing. It's incredibly serious if not managed aggressively.
which brings us, I guess, to the most important question.
Yeah.
How do we stop this from ever happening? How can this be prevented?
Yeah, and the answer is simple but critical. Prevention is absolutely key. The message needs to be crystal clear. Amitraz products should never, ever be used on horses unless, and this is extremely rare in most places, it's a product specifically formulated, tested, and explicitly approved for equine use, and it's being done under direct veterinary guidance.
So basically, just don't use it on horses.
Pretty much. Assume it's not safe unless a vet tells you otherwise about a very specific equine-labeled product, which again is uncommon.
So the practical advice for you listening is really straightforward then.
Absolutely. Always, always read product labels carefully before using anything on your animals. Pesticides, dewormers, topical treatments, read the label. Does it say it's safe for horses? Does it list the active ingredient? If you have any doubt, talk to your veterinarian before you use it. It's always, always better to be safe than sorry with these chemicals.
That seems like incredibly sound advice. So we've kind of come full circle on this deep dive, and hopefully it's given you some really clear aha moments. We've seen how this chemical, Amitraz, which is pretty standard stuff for some animals, poses this really specific and severe danger to horses, all because of how their unique physiology interacts with it.
Exactly. And I think it really highlights just how important it is to understand not just that a chemical works, but how it works, the mechanism, and how different species can react so differently. It really reinforces the value of making informed decisions and especially consulting with experts like your vet when you're dealing with animal health and chemical products.
Definitely. And, it leaves us with maybe a final thought for you to chew on. How does this specific case, Amitraz in horses, make us think differently about other products we use? Other common substances maybe in the barn or the environment? What other surprising species-specific dangers might be out there, looking harmless in one situation but potentially devastating in another? And maybe most importantly, how does this whole conversation reinforce that critical, broader message about really knowing your products, reading those labels, and always, always seeking expert advice? Something to think about.